Hi, my name is Katie Ellis, and I'm a doula from East Tennessee, here to tell you a little bit about what a doula does and the benefits of having one at your birth. So, first off, a doula is a woman who is typically without any formal obstetric training who is employed to provide guidance and support to a pregnant woman during labor. She can be trained in many different areas of expertise regarding pregnancy and birth and also postpartum care. The subcategories that are also included in their training but are not limited to birth and labor, postpartum. There's also loss and bereavement and adoption doulas as well. They can also be trained and sometimes certified to provide other types of services included in their practice, such as placenta encapsulation, belly binding, photography, and aromatherapy, as well as breastfeeding support. So we're going to hit on the three different types of support that doulas offer as far as like a main overall definition. The first one being physical support. What a doula can do while you're in labor as far as physical support goes is they can give you different ideas for positioning, for comfort, or sometimes to help spin a baby that might be in the wrong position or not in the optimal birthing position. They can be trained to know these different types of positions to get the mother in, to either help alleviate some pain or to help get the baby moved either head down or turn the baby around. Another type of physical support that can be offered is counter pressure. A lot of times whenever you have back labor, the baby's turned the wrong way and their face is up instead of facing back. This can cause a lot of painful back labor, and one way of preventing some of that pain that's going on during back labor is to take counter pressure, and that's to take your hand and press in a certain spot on the mother's spine during each contraction, and that helps alleviate some of the pain caused by back labor. That's something a doula can provide as well. There's also counter pressure in the hips that can get behind you during a contraction while you're standing and provide pressure pushing in on your hips, and that also helps with relieving the pain during labor as well in certain situations. There also can be different types of massage that can be done if that's something that the mother's comfortable with. And at this point, if labor is super painful, I'm pretty sure mothers are comfortable with whatever it takes to get some of the relief during this long haul of bringing a baby into the world. Another type of physical support is support for the partner. So what this can be, something simple as just helping the partner kind of facilitate care to the mother, saying maybe you should do this. If it's somebody who's kind of standoffish or is kind of overwhelmed by the entire situation, it's really nice to have a middleman there to kind of like facilitate, hey, maybe this is a good idea, or maybe go hold her hand here, she needs you now, that kind of thing. And it can also really provide help for the mother so that the partner can enjoy the birth and can be more present in the situation without worrying, oh, I'm the only support that the mother has at the moment, because that doula is there to be the continuous 24/7 support with that mother during labor. That way the father or the partner can enjoy, if they want to be down there watching the birth, they don't have to worry about that kind of thing. Another kind of physical support that can be offered is organization. If you've got a doula that you've hired for, prenatal, asking them what can I put in my hospital bag and helping them kind of get things ready for the baby. If it's a new mom and they really just don't know or they don't have anybody to ask, it's really nice to have somebody to just say, hey, come help me organize these things. As well as with the postpartum care, because bringing home a new baby can be a lot of work and it can be extremely overwhelming. So having someone there to maybe take your nursery and just say, hey, maybe this would be easier if this was within your reach, and so you didn't have to get up every time you fed the baby, or maybe we do this and help organize things a little bit and just kind of give you an idea of what might be easier. The second kind of support is the biggest one in my opinion. It's the emotional support offered by a doula. There are times in labor when things are progressing that there might be moments that mom needs encouragement. And there might be moments when mom doesn't need encouragement. She just needs comfort to understand that you're doing the right thing, keep going, it's going to be okay. There might be times where they need both. And that's what a doula does as far as being trained to know how labor progresses and how to know kind of what the mom is feeling in that moment and how to read the room. So they're there to provide encouragement. When the mom's not feeling like she can do it, when it's, oh, I can't do this. Yes, you can. Let's do it. Come on, you can do this. You have this. And then there's moments when they need comfort of, it's okay. This is going exactly how it's supposed to. You are more than capable of doing this and you're doing fantastic. Keep going. Those kind of things. They can really read the moms and say, this is what she needs right now. And also the biggest emotional support that can be offered in a situation where mom was dealing with postpartum depression. So postpartum depression is not an easy thing to talk about. It can be a huge comfort in just having a neutral party to call if mother appears to become upset or depressed, because she might feel ashamed about feeling depressed. Honestly, we're all meant to be mothers at some point, it seems like, so why can't I do this? Why do I feel this way? I'm not going to call my mother and tell her, I don't feel right about having my baby. I mean, that's how some people can feel. It's really nice to have somebody that does this professionally that can say, let's get you some help, or this is normal, or you're doing great, or whatever the mom needs in that moment. If it's an immediate need where the mother feels like she really wants to hurt herself or her baby, the doula can really see that and say, okay, we need to take immediate action right now. Here are my resources, and the doula might have some really good resources that can be used in that situation. And it's also really good to have a doula on hand for the partner, because even if the mother doesn't want to call, the partner can see the immediate need and he can call and he can say, hey, something's up. This is not okay. I don't feel right about this. What can we do? Can you help me? That's a really big emotional support to have, just knowing that somebody is going to be there for you when you're going through this new change. The third point that I want to get to is mother advocacy. It is so important to have somebody there that is on your side that's not part of the medical team. And basically what that means is, like, for prenatally, they can be there to help you make sure that you're making the right decisions about your birth plan, and they can help you make these informed decisions from a neutral ground. You want to have a natural birth, if you want to have a C-section, they can help you look through all the possibilities and all the pros and cons without it being from a medical standpoint, of it being from a real life standpoint, and just help you make the right decision. And that also goes the same during labor. Things can move really fast or things can move really slow. And sometimes when things move really slow, hospitals want to get a move on and start pushing these different types of treatments to get things going. Sometimes that's not always the best case. And a lot of times these mothers are exhausted and they don't know that they're making the right decision. But the doula's job is not to make decisions for the mother, but it is to help them make the right decisions and to help them make sure they know what they're doing and what they're choosing and the possibilities that they don't have to choose these things. It just seems like they do in the time because that was the only option that they were given. They can also really help translate different procedures because a lot of medical terminology can be used. And again, when you're 24 hours into labor, you don't really know what you're talking about. You don't really know what people are talking about. So if you don't work in the medical field, things can be really confusing really, really quick. So it's really nice to have somebody there that can kind of say, okay, this is what this really means. Or when they say that, this particular drug causes an adverse effect, that's what that means. And they can help explain things to be a little bit more easier to understand. And the benefits of having a doula, to me, are beyond measure, because I had one at my birth, and that woman is a saint. I would never go without a doula again for a birth, and this was long before I decided to do this for, a job, and I found my passion for it. There's a doctor named Dr. Yvonne Toba that I found on an article on PubMed that listed a bunch of benefits that were scientifically backed by different surveys and different research that was done. They showed mothers that labored with a doula by their side for 24-hour continuous support used a decreased use of pain medication during labor. There was a decreased incidence of C-sections, a decrease in the length of labor, a decrease in negative childbirth experiences, and a doula might add another option to the mix when decisions need to be made about labor and delivery. However, a doula does not provide medical advice, nor can she or he change the clinical recommendations of a midwife or an OB. And that was my earlier statement of, we are not here to make decisions for the mother, we're just here to make sure that you're making the right decisions. Another study was from the American Pregnancy Association. They say that numerous studies have been documented the benefits of having a doula present during labor. A recent Cochrane review, Continuous Support Women during Childbirth, showed a very high number of positive birth outcomes when a doula was present. With their support, women were less likely to have pain relief medications administered, less likely to have a C-section, and women also reported of having a more positive childbirth experience. So that just goes to show that even in the medical field, they may not understand it at your local hospital because it's never been seen, or they may not know exactly what you're talking about. But research has been done to show the benefits of having a doula. And if it's just something that you're thinking about, always have a consultation with one. You may be surprised at just how comfortable she really does make you feel, and how she may be able to give you a couple of ideas of what she can do for you. I hope you really appreciated this little presentation, and I hope you have a wonderful day. If you have any questions, feel free to message me or email me. I'm going to link my email below, and if you don't mind, if you really enjoyed this presentation, to fill out the survey linked at the bottom, please. It would I would appreciate it, and it would help me a lot. I'm getting my words twisted now. So I'm going to go ahead and stop, but I really do appreciate you all and all the expecting mothers out there. I hope you have a wonderful birth, and I hope you enjoy your little bundles. Bye.